In this video, we will explore a theory proposed by Dr. Diaa Al-Din Al-Awadi, a theory described as the zero medication lifestyle. According to reports associated with this approach, thousands of cases involving various chronic diseases have reportedly experienced recovery simply by completely eliminating certain foods while allowing the consumption of other specific foods and dietary items. In the upcoming videos, we will review these recovery cases together, as well as the foods that are prohibited and those that are permitted within this approach. For now, we will present the 10 principles upon which Dr. Al-Awadi's Tayyibat theory is based. Principle 1. The natural state of the human body is health. According to Dr. Diaa Al-Din, the original state of the human body is one of health and balance. Human beings are born with this healthy nature, and the body continues to maintain this condition as long as it is not affected by any violent external influences or external inputs. According to this perspective, complete fasting from all forms of intake allows the body to fully return to its natural state of health and balance. However, this condition does not continue indefinitely. Within this view, it inevitably comes to an end the moment the fast is broken by the first substance that enters the body. This theory further suggests that if a person were able to remain in that state without any form of intake, he or she would exist in the condition of a body that does not become ill. Principle 2. Every intake carries both benefit and harm. Dr. Diaa Al-Din then introduces another concept. Everything that enters the body carries both benefit and harm at the same time. The benefit lies in sustaining life and providing the body with the nourishment it needs to remain functional and capable of performing its duties. It also supports normal growth and development in children. On the other hand, he argues that every substance entering the body leaves behind waste products. These wastes must be processed, eliminated, and expelled from the body. From his perspective, these very waste products represent the harm inherently associated with that intake. Therefore, according to this view, every food or drink we consume possesses two inseparable aspects: a benefit represented by sustaining life and promoting growth, and a harm represented by the waste it produces and the body's need to eliminate it. Principle 3. The body considers every intake a foreign entity. According to this theory, the human body treats anything that enters it as a foreign entity. As a result, the body does not respond to incoming substances in a neutral manner. Instead, it produces a specific reaction toward them. Dr. Diaa Al-Din states that this response follows one of three major pathways. The first pathway is the allergic immune pathway, which operates through the lymphatic system. In this process, the immune system recognizes the incoming substance as a foreign agent that requires a response. The second pathway is the central nervous system pathway, which he refers to as the blood-brain axis, describing the axis associated with the relationship between the brain and the various influences to which the body is exposed. The third pathway is the hormonal glandular pathway, which is divided into two categories. First, the peripheral intestinal hormonal pathway, which includes several hormones secreted within the digestive system, such as insulin, glucagon, serotonin, gastrin. Second, the central pituitary hormonal pathway, referring to the system that functions through the pituitary gland and extends to the adrenal gland. Accordingly, Dr. Diaa Al-Din believes that any substance entering the body triggers one or more of these three responses: an allergic immune response, a central nervous system response, or a hormonal glandular response. Principle 4. The body's daily struggle with intake. In this principle, Dr. Diaa Al-Din proposes that the human body does not always deal easily with dietary or environmental inputs. Rather, it lives in a constant and recurring state of daily struggle as it attempts to cope with them. According to this perspective, certain substances that are difficult to digest may, over time, lead to recurrent intestinal blockages, even if those blockages are not complete. Furthermore, incomplete digestion may leave behind harmful residues that remain within the body. As a result, substances that are not properly digested become an additional burden on the body's various systems. According to this theory, the issue is not limited to digestive difficulty alone. Some inputs are also believed to contain stimuli that affect the nervous system, the hormonal system, or the allergic immune system. In addition, Dr. Diaa Al-Din argues that human beings are continuously exposed to what he calls explicit toxins, chemical substances that may reach the body through food or the surrounding environment. Examples include residues of antibiotics, residues of fertilizers and growth enhancers, residues of stimulants, artificial colorings, various chemical substances, nitrogen-based fertilizers, residues of pesticides, referred to as pesticide residues. Based on this view, the body lives under the daily pressure of dealing with recurrent intestinal blockages, the harmful byproducts of incomplete digestion, stimuli affecting the nervous, hormonal, and immune systems, and the ongoing exposure to multiple sources of toxins. Principle 5. Chronic pressure and the emergence of syndromes. Dr. Diaa Al-Din believes that the continuation of this ongoing struggle places the body under constant pressure, causing it to enter a continuous state of resistance. He argues that this persistent pressure leads to the development of recurring physical and psychological symptoms that are interconnected in their occurrence. However, because these symptoms may appear at different times, the relationship between them often becomes unclear. According to this perspective, this is how the concept of syndromes emerged. Groups of symptoms become clustered under a single label, while the true causal relationship between them remains uncertain, resulting in ambiguity in diagnosis. He further suggests that the problem may worsen due to interactions between toxins that have entered the body and the medications people take to treat different symptoms. A person may be affected by a particular intake or by a state of poisoning and then take medication for another symptom, leading to interactions among the various substances present within the body. He refers to this phenomenon as drug-drug interaction, that is, interactions between medications. As an example, he suggests that a person may take medication for high blood pressure, while other substances are already exerting effects within the body. This may result in interactions of which the person is unaware, potentially worsening the condition. According to this view, this process contributes to increased severity of symptoms, the overlap and mixing of diseases and symptoms, the emergence of similar disease groupings. Examples of these groups include the fibromyalgia group, the high blood pressure group, the diabetes group, the immune disease group, the cancer group. According to this theory, diseases continue to be classified into different groups, while the true underlying cause remains difficult to identify clearly. Principle 6. The digestive system and acid-suppressing medications. In this principle, Dr. Diaa Al-Din proposes that regardless of the name of the disease or the nature of the symptoms a person experiences, there is, in his view, a chronic dysfunction of the digestive system accompanying the illness. He further suggests that this dysfunction may be present even when the initial complaints began during early childhood. He also draws attention to the widespread use of acid-suppressing medications over recent decades, noting that they have become commonly used since around the year 2005. Dr. Diaa Al-Din believes that, with the progression of diseases and the increasing incidence of cancers, the possibility that acid-suppressing medications may play a role in the emergence of these symptoms, and health changes should not be overlooked. From his perspective, the effects of these medications should form part of the discussion when attempting to understand the development of chronic diseases and to explain their underlying causes. Principle 7. Treating what is not the true cause. In this principle, Dr. Diaa Al-Din argues that a significant portion of medical practice revolves around treating factors that are not the true underlying cause of the problem. According to this perspective, individuals may experience a variety of symptoms such as a sudden twinge or stabbing sensation in the chest, blurred vision, dry mouth or reduced saliva, kidney pain, frequent urination. These symptoms are then attributed to various diagnoses, including hiatal hernia, elevated cholesterol levels, high triglyceride levels, increased uric acid levels. Dr. Diaa Al-Din considers attributing these symptoms to such explanations to be a form of what he describes as agreed-upon misconceptions. In other words, from his perspective, the actual problem is not being addressed, while attention is focused instead on explanations that do not represent the original cause of the disease. Principle 8. What do laboratory tests really mean? Dr. Diaa Al-Din then turns to the subject of laboratory findings and investigations, commonly referred to as clinical laboratory investigation. He argues that changes observed in these laboratory tests, such as elevated blood glucose levels, increased urea levels, increased creatinine levels, elevated uric acid levels, do not constitute definitive evidence that they are the direct cause of the symptoms experienced by the patient. Rather, he considers these changes to be reflections of a shift in the body's strategy as it responds to a continuous state of pressure and chronic stimulation. From this perspective, he proposes a principle that he regards as fundamental. The true cause is the one that, when removed, causes both the problem and the symptom to disappear. He provides several examples to illustrate this idea. If insulin is administered with the intention of lowering blood glucose levels, yet blood sugar continues to rise, then according to this view, elevated blood sugar was not caused by a deficiency of insulin. If insulin lowers blood glucose levels, but erectile dysfunction does not improve, then, according to this perspective, elevated blood sugar is not the true cause of erectile weakness or erectile dysfunction. He also presents another example concerning reflux disease. If a hiatal hernia is treated while reflux symptoms remain unchanged, then the hiatal hernia is not the true cause of the reflux. Likewise, if the infection is treated and reflux persists without improvement, then, according to this approach, the microorganism is not the true underlying cause either. He concludes that when symptoms persist, despite the removal of an assumed cause, this indicates the need to search for another cause that is deeper and more fundamental. Principle 9. Laboratory markers and their relationship to food. Dr. Diaa Al-Din considers it superficial and entirely incorrect to directly associate certain laboratory findings with the type of food a person consumes. Among the markers he refers to are blood glucose, acetone, HDL, that is, high-density lipoprotein, also known as good cholesterol, LDL, that is, low-density lipoprotein, also known as bad cholesterol, urea, creatinine, minerals, and electrically conductive mineral fluids, known as electrolytes, such as sodium, potassium, chloride. He justifies this view by arguing that these indicators are present in all creatures that possess a liver. According to him, crocodiles have them, chickens have them, cows that feed on grass have them, tigers that eat meat and drink blood have them, and even mice possess them. Therefore, he maintains that all mammals and egg-laying creatures with a liver have blood glucose, acetone, HDL, LDL, urea, creatinine. This is because, in his words, the liver was created to produce these substances. From this perspective, elevations or reductions in these values beyond their usual ranges are not, in his opinion, directly caused by the type of food consumed. For this reason, he rejects the idea that eating sugar automatically raises blood glucose levels, or that consuming protein directly increases uric acid levels. Instead, he argues that changes in these markers are fundamentally related to changes in the body's own condition, resulting from nervous responses, hormonal responses, allergic immune responses, regardless of the nature of dietary inputs. To illustrate this point, he notes that a duck and a tiger, despite the major differences in their diets, both possess the same markers, such as creatinine, urea, blood glucose, and acetone. According to this view, this indicates that the mere presence of these substances is not directly linked to the type of food consumed. Principle 10. The body's capacity for recovery and the zero medicine approach. In concluding this theory, Dr. Diaa Al-Din speaks about the body's ability to recover and heal itself. He believes that this capacity manifests itself in multiple forms, including replacement and renewal, production and synthesis, defense and prevention, formation and differentiation. He describes this ability as an integrated, harmonious, and virtually limitless capacity, constrained only by death. Based on this view, he links a person's level of health to their ability to avoid toxic inputs. He presents his final equation as follows. Your health, relatively speaking, is equal to your ability to avoid toxic inputs. He then summarizes the philosophy of this approach in the following statement. Zero toxic inputs equals infinite health. He considers this idea to represent the essence of what he describes as the zero medicine lifestyle approach. Documentary conclusion. These were the 10 principles presented by Dr. Diaa Al-Din as part of his personal perspective on understanding illness, health, and recovery. In this video, we have attempted to present this theory exactly as it was introduced, without endorsing it or rejecting it, and without adding to or removing from its essential content, while reorganizing it to make it clearer and more accessible to viewers. Ultimately, the evaluation of any health or medical theory remains connected to patients' experiences, the outcomes observed among those who apply the system, and the cases of healing and recovery seen in real life. According to accounts and reports associated with this approach, it has been stated that thousands of individuals suffering from a wide variety of illnesses have experienced healing or significant improvement. In the upcoming videos, we will explore these experiences together and review the reported cases of healing and recovery as they have been presented and shared within the framework of this methodology.